Imagine infusing your golden years with vitality and joy through simple daily habits. In this video, we unveil the top 5 vitamins that can help you achieve just that. These essential nutrients support energy levels, cognitive function, and overall well-being, enabling you to embrace life with enthusiasm and purpose. Stay tuned to discover how these vitamins can be seamlessly incorporated into your routine for a healthier, more vibrant you. Welcome. I'm a doctor from Golden Year Health Hub, and today we're diving into the essential vitamins that can help you lead a longer, healthier life. Whether you're 60 or 90, it's never too late to invest in your well-being. As we age, our bodies undergo various changes that can affect our health. Nutritional needs evolve, and certain vitamins become increasingly important to maintain optimal function. In this video, we'll explore the top vitamins that play a crucial role in supporting the aging process. One such vitamin is vitamin D, which is vital for bone health and immune system function. As we age, our skin's ability to produce vitamin D from sunlight decreases, making supplementation important. Another essential nutrient is vitamin B12. This vitamin supports nerve function and the production of red blood cells. Absorption of vitamin B12 can decrease with age, so it's important to monitor levels and consider supplementation if necessary. Vitamin C is also crucial for older adults. It acts as an antioxidant, protecting cells from damage, and supports the immune system. Additionally, it aids in the absorption of iron from plant-based foods. Magnesium is another key mineral that supports muscle and nerve function, as well as energy production. It's found in various foods, but supplementation may be necessary for some individuals. As we age, our bodies undergo various physiological changes that can impact how we absorb and utilize nutrients. These changes make it increasingly important to ensure we're getting the right vitamins to support our health and well-being. One of the most significant changes with aging is the alteration in digestive function. The stomach's ability to produce acid decreases, which can impair the absorption of certain nutrients, such as vitamin B12. Additionally, the lining of the intestines may become less efficient, reducing nutrient absorption overall. Metabolic rate tends to slow down with age, affecting how the body processes and utilizes nutrients. This slower metabolism can lead to a decreased need for certain vitamins. But it can also mean that deficiencies develop more slowly and may go unnoticed until they become more severe. Older adults often experience changes in appetite and dietary habits, which can result in reduced intake of essential vitamins. Factors such as dental issues, difficulty swallowing, or changes in taste and smell can make eating less enjoyable, leading to a less varied diet that may lack key nutrients. Aging can affect the immune system's ability to respond to infections and illnesses. Certain vitamins, such as vitamin D and vitamin C, play crucial roles in supporting immune function. Deficiencies in these vitamins can lead to increased susceptibility to infections and slower recovery times. Vitamin B12 and folate are essential for maintaining healthy brain function. Deficiencies in these vitamins have been linked to cognitive decline and an increased risk of conditions such as dementia. Ensuring adequate intake of these nutrients is vital for preserving cognitive health as we age. Vitamin D, the sunshine vitamin. Vitamin D is vital for the absorption of calcium in the gut, which is necessary for maintaining healthy bone density. It helps regulate calcium and phosphate levels in the blood, promoting bone mineralization and preventing bone loss. A deficiency in vitamin D can lead to conditions such as osteomalacia, softening of the bones, and osteoporosis, characterized by brittle and fragile bones. Research indicates that adequate vitamin D levels can reduce the risk of osteoporosis and related fractures. A study published in The Lancet Diabetes and Endocrinology found that vitamin D supplementation, particularly when combined with calcium, can help prevent fractures in older adults. Vitamin D plays a significant role in modulating the immune system. It enhances the pathogen-fighting effects of monocytes and macrophages and decreases inflammation. Vitamin D receptors are present on various immune cells, including T cells and B cells, influencing both innate and adaptive immune responses. A deficiency in vitamin D has been associated with an increased susceptibility to infections and autoimmune diseases. For instance, individuals with low vitamin D levels are more prone to respiratory infections and may have a higher risk of developing autoimmune conditions, such as multiple sclerosis and rheumatoid arthritis. There is growing evidence suggesting that vitamin D may play a role in cancer prevention. Observational studies have found that low levels of vitamin D are associated with an increased risk of certain cancers, including colorectal, breast, and prostate cancers. The active form of vitamin D, calcitriol, has been shown to inhibit cancer cell growth and promote apoptosis, programmed cell death, in cancerous cells. However, while observational studies suggest a link between vitamin D deficiency and cancer risk, clinical trials have not consistently demonstrated that vitamin D supplementation reduces cancer incidence. The American Cancer Society notes that more research is needed to determine the effectiveness of vitamin D supplementation in cancer prevention. Vitamin D deficiency can lead to weakened bones, increased risk of fractures, and compromised immune function. It is particularly prevalent among older adults, individuals with limited sun exposure, and those with certain medical conditions. Conversely, excessive intake of vitamin D can lead to toxicity, resulting in a hypercalcemia, elevated calcium levels in the blood, which can cause nausea, weakness, and kidney problems. It is important to adhere to recommended daily allowances and consult with a healthcare provider before starting supplementation. Vitamin D is essential for maintaining bone health, supporting immune function, and potentially reducing the risk of certain cancers. Ensuring adequate levels through sunlight exposure, diet, and supplementation can help promote overall health and well-being. As always, it is advisable to consult with a healthcare professional before making significant changes to your vitamin D intake. By understanding the importance of vitamin D and taking proactive steps to maintain adequate levels, individuals can support their health and reduce the risk of various health issues associated with deficiency. Vitamin B12, energy and brain health. Vitamin B12, also known as cobalamin, is a water-soluble vitamin that plays a crucial role in various bodily functions, including nerve health, energy production, and red blood cell formation. Since the body cannot produce vitamin B12 naturally, it must be obtained through diet or supplements. Vitamin B12 is essential for maintaining the health of nerve cells. It is involved in the synthesis of myelin, the protective sheath that surrounds nerves. A deficiency in B12 can lead to nerve damage, resulting in symptoms such as numbness, tingling in the hands and feet, difficulty walking, and cognitive disturbances. These neurological issues can be severe and may become irreversible if left untreated. B12 is vital for converting carbohydrates into glucose, which the body uses for energy. A deficiency can lead to fatigue, weakness, and low energy levels. Additionally, B12 is involved in the production of red blood cells, which carry oxygen throughout the body. Inadequate B12 levels can result in megaloblastic anemia, characterized by fatigue and weakness. Vitamin B12 is important for brain health and the production of neurotransmitters that regulate mood. Deficiency has been linked to mood disturbances, memory loss, and cognitive decline. In older adults, low B12 levels have been associated with an increased risk of dementia and cognitive impairment. Symptoms of vitamin B12 deficiency can vary and may develop gradually. Common signs include fatigue and weakness, numbness or tingling in the hands and feet, difficulty walking and balance problems, memory loss, and cognitive difficulties. Mood changes, including depression and irritability, pale or jaundiced skin glossitis, swollen, inflamed tongue, shortness of breath and dizziness. These symptoms can overlap with other health conditions, making diagnosis challenging. A blood test measuring B12 levels can confirm deficiency. Certain groups are at higher risk of vitamin B12 deficiency. Older adults. Aging can reduce stomach acid production, impairing B12 absorption. Vegetarians and vegans. Since B12 is primarily found in animal products, plant-based diets may lack sufficient B12. Individuals with gastrointestinal disorders. Conditions like celiac disease, Crohn's disease, and those who have undergone certain surgeries can affect B12 absorption. People taking certain medications. Medications such as proton pump inhibitors and metformin can interfere with B12 absorption. Vitamin B12 deficiency is typically treated with dietary changes, oral supplements, or B12 injections depending on the severity. For individuals with absorption issues, injections may be necessary. It's important to consult a healthcare provider for appropriate diagnosis and treatment. Preventing deficiency involves consuming adequate amounts of B12-rich foods or taking supplements if necessary. Regular monitoring of B12 levels is recommended for at-risk populations. Maintaining optimal vitamin B12 levels is essential for overall health, particularly for nerve function, energy production, and cognitive well-being. If you experience symptoms of deficiency, consult a healthcare provider for evaluation and appropriate management. By understanding the importance of vitamin B12 and taking proactive steps to maintain adequate levels, individuals can support their health and reduce the risk of various health issues associated with deficiency. Vitamin C, immune support. Vitamin C, also known as ascorbic acid, is a water-soluble vitamin that plays a crucial role in various bodily functions. It is essential for the growth and repair of tissues, the formation of collagen, and the proper functioning of the immune system. Since the human body cannot synthesize vitamin C, it must be obtained through dietary sources such as citrus fruits, bell peppers, strawberries, and broccoli. Vitamin C is integral to the proper functioning of both the innate and adaptive immune systems. It contributes to immune defense by supporting various cellular functions, including the production and function of white blood cells, which are essential for combating infections. Additionally, vitamin C enhances the skin's defense system and helps wounds heal more quickly. As a powerful antioxidant, vitamin C helps protect cells from oxidative stress caused by free radicals. This oxidative damage can lead to chronic diseases such as heart disease and cancer. By neutralizing free radicals, vitamin C reduces the risk of these conditions and supports overall health. Vitamin C is essential for the synthesis of collagen, a protein vital for the health of skin, blood vessels, bones, and cartilage. It also aids in the absorption of non-heme iron from plant-based foods, enhancing iron status and preventing anemia. Additionally, vitamin C supports the healing of wounds and the maintenance of healthy gums. Symptoms of vitamin C deficiency can vary and may develop gradually. Common signs include fatigue and weakness, numbness or tingling in the hands and feet. Symptoms of vitamin C deficiency can vary and may develop gradually. Common signs include fatigue and weakness, numbness or tingling in the hands and feet. Difficulty walking and balance problems, memory loss and cognitive difficulties. Mood changes, including depression and irritability, pale or jaundiced skin glossitis, swollen, inflamed tongue, shortness of breath and dizziness. These symptoms can overlap with other health conditions, making diagnosis challenging. A blood test measuring B12 levels can confirm deficiency, difficulty walking and balance problems. At-risk populations. Certain groups are at a higher risk of vitamin B12 deficiency. Older adults. Aging can reduce stomach acid production, impairing B12 absorption. Vegetarians and vegans. Since B12 is primarily found in animal products, plant-based diets may lack sufficient B12. Individuals with gastrointestinal disorders. Conditions like celiac disease, Crohn's disease, and those who have undergone certain surgeries can affect B12 absorption. People taking certain medications. Medications such as proton pump inhibitors and metformin can interfere with B12 absorption. Vitamin B12 deficiency is typically treated with dietary changes, oral supplements, or B12 injections, depending on the severity. For individuals with absorption issues, injections may be necessary. It's important to consult a healthcare provider for appropriate diagnosis and treatment. Preventing deficiency involves consuming adequate amounts of B12-rich foods or taking supplements if necessary. Regular monitoring of B12 levels is recommended for at-risk populations. Calcium, bone strength. Calcium is essential for maintaining strong bones and plays a crucial role in various bodily functions, including muscle contraction, blood clotting, and nerve transmission. Approximately 99% of the body's calcium is stored in the bones and teeth, highlighting its importance in skeletal health. Calcium provides structural support to bones and teeth, ensuring their strength and density. Adequate calcium intake is vital during childhood, adolescence, and early adulthood when bone mass is being built. In adulthood, maintaining sufficient calcium levels helps prevent bone loss and reduces the risk of fractures. Vitamin D enhances calcium absorption in the gut and maintains adequate serum calcium and phosphate concentrations to enable normal mineralization of bone. It also plays a role in bone remodeling by osteoblasts and osteoclasts. Without sufficient vitamin D, bones can become thin, brittle, or misshapen. Studies have shown that the combination of calcium and vitamin D supplementation can lead to a modest reduction in the risk of fractures, particularly in older adults. For instance, a meta-analysis indicated that supplementation with both nutrients resulted in a 6% reduction in the risk of any fracture and a 16% reduction in the risk of hip fractures. While calcium and vitamin D are crucial for bone health, excessive intake can lead to adverse effects. Overconsumption of calcium supplements may increase the risk of kidney stones and cardiovascular issues. Therefore, it's essential to adhere to recommended dietary allowances and consult healthcare providers before starting supplementation. Incorporating calcium and vitamin D-rich foods into your diet is an effective way to support bone health. Calcium-rich foods. Dairy products like milk, cheese, and yogurt. Leafy green vegetables such as kale and bok choy. Fortified plant-based milks and juices. Tofu and tempeh. Almonds and sesame seeds. Vitamin D-rich foods. Fatty fish like salmon, mackerel, and sardines. Egg yolks. Fortified foods like cereals and orange juice. Mushrooms exposed to sunlight. Beef liver. Additionally, moderate sun exposure can stimulate the body's production of vitamin D. Populations at higher risk. Certain groups may require additional attention to their calcium and vitamin D intake. Older adults. Age-related changes can affect calcium absorption and bone density. Postmenopausal women. Decreased estrogen levels can lead to increased bone resorption. Individuals with limited sun exposure. Those who spend little time outdoors may have lower vitamin D levels. People with dietary restrictions. Vegans or lactose-intolerant individuals may have limited access to calcium-rich foods. For these populations, dietary adjustments or supplementation may be necessary to maintain optimal bone health. Maintaining adequate levels of calcium and vitamin D is essential for bone health and the prevention of fractures. While supplementation can be beneficial, it's crucial to approach it cautiously and under the guidance of a healthcare professional. Prioritizing a balanced diet, regular physical activity, and healthy lifestyle choices can significantly contribute to strong and healthy bones throughout life. For personalized advice and recommendations, consult with a healthcare provider or a registered dietitian. Omega-3, fatty acids, heart and brain health. Omega-3 fatty acids, particularly eicosapentaenoic acid, EPA, and docosahexaenoic acid, DHA, are essential polyunsaturated fats that play a pivotal role in maintaining cardiovascular health and cognitive function. These nutrients are primarily found in fatty fish, such as salmon, mackerel, and sardines, as well as in plant-based sources like flax seeds and walnuts. Consuming omega-3 rich foods has been associated with a reduced risk of heart disease. The American Heart Association recommends eating at least 2 servings of fatty fish per week to support heart health. Omega-3s help lower blood pressure, reduce triglyceride levels, and decrease the risk of arrhythmias. They also have anti-inflammatory effects that can protect the blood vessels and reduce the risk of stroke. A study published by the Mayo Clinic highlights that omega-3 fatty acids may lower levels of fats called triglycerides in the blood, which can reduce the risk of heart disease and stroke. Additionally, omega-3s may slightly lower blood pressure and reduce the risk of irregular heartbeats. Omega-3 fatty acids are crucial for brain health, influencing various brain processes and structures. DHA, in particular, is a major structural component of the human brain and retina. Adequate intake of omega-3s supports cognitive function, memory, and mood regulation. Research indicates that omega-3s may help improve brain function in older adults with mild cognitive impairment, or those at risk for Alzheimer's disease. A study found that taking omega-3 supplements was associated with better brain function in people with coronary artery disease, which increases the risk of dementia. Salmon is an excellent source of EPA and DHA, making it a heart-healthy and brain-boosting food choice. Including salmon in your diet can provide the necessary omega-3s to support overall health. The American Heart Association recommends eating at least 2 servings of fatty fish per week, such as salmon, to reap the cardiovascular benefits of omega-3s. Salmon can be enjoyed grilled, baked, or incorporated into salads and pasta dishes. For those who prefer plant-based sources, flax seeds, chia seeds, and walnuts are rich in alpha-linolenic acid, ALA, a type of omega-3 fatty acid. While ALA is beneficial, it needs to be converted into EPA and DHA in the body, a process that is not very efficient. Therefore, including a variety of omega-3 sources in your diet is advisable. While omega-3 fatty acids offer numerous health benefits, it's important to consume them in appropriate amounts. Excessive intake, particularly from supplements, can lead to adverse effects such as increased bleeding risk. It's recommended to consult with a healthcare provider before starting omega-3 supplements, especially for individuals with existing health conditions or those on blood-thinning medications. Incorporating omega-3 rich foods like salmon into your diet can significantly contribute to cardiovascular health and cognitive function. By making informed dietary choices, you can support your heart and brain health, leading to improved overall well-being. To recap, the top 5 vitamins for seniors are vitamin D, B12, C, calcium, and omega-3s. Incorporating these into your daily routine can make a significant difference in your health. Thank you for joining us. If you found this information helpful, please like, share, and subscribe for more health tips. Remember, it's never too late to take charge of your health.